This is Dr. Andy Higgins at the Ben Vitality Clinic, and this video segment is to address the frequently asked question of what are different hair transplantation procedures and how are they different? Well, hair transplantations have been happening for quite a while, and the early ones that were being performed were the old plug procedures. Essentially, they would take a core of hair with 10, 15, 20 hair follicles in that core, and then they would extract it again from the donor zone and move it to an area that required some coverage. Well, it didn't look good. It really looked more like bunch grass rather than an even distributed grass. So that is not what is currently happening. Then techniques evolved and they started doing Follicular Unit Transplant, FUT, also known as a strip procedure. What that is essentially is the surgeon will literally take a strip of the scalp from the donor zone, from the back of the head, surgically excise that, give it to their technicians. Their technicians then will go through that and sliver it, and then individually create individual follicles for implantation. The surgeon then, using sutures, closes that incision site up in the back of the scalp. It does leave a visible scar, more pronounced if someone keeps their hair really short. If someone has their hair long, then the scar is typically not very noticeable. But there is a scar nonetheless. Good durable procedure, good results from it. I think its biggest benefit is that we can do large harvestings to cover large areas. If someone requires 3,000, 4,000 grafts, a strip procedure is an excellent way to do that. The other benefit is you don't thin out any of the donor zone. You're literally extracting a component of the donor zone and then closing it back up, so the rest of the donor zone remains the same density, number of hair follicles per square centimeter. Again, the downside is you're left with a scar on the back of the head. We don't do that procedure here at the Ben Vitality Clinic. Then came along Follicular Unit Excision. Now, this is when you would individually extract the hair follicles with a tiny core punch biopsy maneuver, usually about 1 millimeter, sometimes even a little smaller than that. That can either be done handheld with the surgeon utilizing almost like a little Dremel, a little drill that individually harvests those out of the back of the scalp, or that's done robotically, and that's what we specialize here at the Ben Vitality Clinic. The handheld is good if the good quality surgeons can do it. The concerns are always is areas over harvested, so there's patchy areas and other areas under harvested. But still a good procedure overall. But the computer accuracy and the robotic precision of harvesting those individual follicles, and the beauty of it, once it identifies the follicle it's going to harvest, it then puts a little protective ring around that. And so the computer then knows, do not harvest anything else in that. That's how we can get that even distributed harvest zone, the donor area, so we're not having patchy areas of over and under harvesting. Even with the way we utilize our robot here is we primarily utilize it for the donor zone for extracting the follicles. Then I've either created the site the night before or the day of, all the recipient sites where those hair follicles are going to go, and then I have technicians individually place those hair follicles into the recipient zone, the area that we need coverage. Thank you for your attention. I hope you found this video helpful.